recording of a summary of a CBC News article titled "COVID-19 hasn't gone anywhere in Canada, and we could still see another surge," written by Lauren Pelly and Adam Miller. CBC News posted March 19, 2022. Public health measures are lifting in Canada while COVID-19 levels decrease following the Omicron wave. A recent global rise in COVID-19 cases, a new Omicron subvariant spreading, and an increase in early surveillance signals has fueled fear that another wave could occur. Canada's Chief Public Health Officer Dr. Theresa Tam said on Friday that average daily case counts are leveling off, and that increases in transmission are expected after easing of public health measures. Testing of COVID-19 has dropped due to limitations, while wastewater data and hospitalizations remain high. Over 4,000 Canadians are hospitalized due to COVID-19, the highest it's been since April 2021, similar to those during earlier peaks of COVID-19. High vaccination coverage and immunity currently deter serious illness in the general population. The Omicron variant and BA.2 subvariant is showing greater infectivity than all other past variants. Infection immunity from boosters is declining, whereas hospitalization immunity remains steady. Infection protection dropped from 69% within 2 months of a second dose to 37% after 5 months, reports showed. A booster increases protection to 87%, but then drops to 66% after 4 months and 31% after 5 months. Those with a booster shot were 94% less likely to be hospitalized with a ventilator or die upon infection. Less than half of Canadians have received a booster shot. Based on wastewater detection, case counts are estimated to be between 15,000 and 20,000 daily cases, and hospitalizations are expected to increase. Calgary and Saskatchewan wastewater data show an increase in COVID-19 levels. Saskatoon data shows that BA.2 subvariant makes up nearly half of the virus load. BA.2 is expected to overtake BA.1 as the dominant strain. Prince Edward Island and Newfoundland are also finding that positivity rates are increasing. Cases are increasing worldwide. Between March 7th and March 13th, 11 million new cases and 43,000 deaths occurred. South Korea and China saw the most increases in both cases and deaths. Denmark and the UK are also seeing a rise in cases and hospitalizations. BA.2 currently accounts for 22% of Canadian cases, and it is 30% more infectious than other variants. Dr. Theresa Tam expects it to become the dominant strain. Communities low in vaccine coverage, lower-income residents in crowded housing, and multi-generational homes are at increased risk of transmission and health complications. This was a recording of the CBC News article titled "COVID-19 hasn't gone anywhere in Canada, and we could still see another surge,"